Hi, I'm Veronica. That's me on the left. And on the right, my cousin, Alicia, who was diagnosed with MS in her 30s. She'd been very healthy up until then, active in everything, seriously, no issues. According to Mayo Clinic, multiple sclerosis is a disease which affects the spinal cord and brain. A patient with MS experiences degradation of the myelin sheath, which protects nerve fibers. Because of this, nerve fibers or axons are partially exposed. The brain body connection is disrupted, and in often cases, myelin sheath degradation is permanent. According to the National Institute of Health, MS may also affect retinal nerves and cause shrinking in the cerebral cortex, resulting in cortical atrophy. Symptoms of MS are commonly first experienced between the ages of 20 and 40 and might include unsteady gait, vertigo, issues with coordination, sensation of electric shock which begins at the neck, extends to the spine, and a patient's limbs or extremities, numbness in limbs or tingling sensations, bladder incontinence, and double vision. Symptoms of MS vary in intensity across patient populations, and the disease itself is typically not fatal. MS might occur after exposure to Epstein-Barr virus, which is common, as according to the National Institute of Health, only 5% or less of the population has not been exposed to EBV. The issue here is that if exposed to EBV later in life, the immune response is robust and may lead to the confounding of myelin as something novel or unfamiliar to be destroyed by immune system cells. As of last year, research proposed that C. perfringens can bind to CNS blood vessels and potentially trigger MS. Now, there are different classes of treatments for MS, including oral treatments, infusion treatments, and injectable treatments. I'm going to focus on one injectable treatment called Avonex, which is comprised of interferon beta-1b. So, what is interferon beta-1b? It is a glycoprotein which is created through recombination. Interferons are molecules which can moderate or manage immune cells. Eukaryotic cells create interferons during an immune system response. Specifically, interferon beta-1b is a cytokine, created from macrophages and originating in fibroblasts. Now, there are different types of cytokines in the human body, consisting of chemokines, interferons, interleukins, tumor necrosis factor, colony-stimulating factors, lymphokines, and monokines. Interferon beta-1b is the MHC class I molecule which aids in the human immune system identifying familiar and unfamiliar by conferring antigens to immune cells, thereby decreasing myeloid dendritic presence in blood that is peripheral. It can lessen antigen-presenting cells and increase the response of CD8 plus T cells that precede cytotoxic T lymphocytes. Now, Avonex is an antiviral drug administered as an intramuscular subcutaneous injection. The injection needs to be refrigerated and stored between 2 to 8 degrees Celsius and cannot be stored above 25 degrees Celsius or room temperature for more than 7 days. This is due to its suspension in glucose, which is a reducing sugar. If the temperature is too high, glycolysis will occur and the product will degrade, leading to an inactivation of the drug. So, interferon beta-1b therapy, which is suspended in mannitol, is non-reactive to protein and can remain at room temperature for up to 2 years. Since injectable interferon therapies may be self-administered by patients, the use of mannitol may be more cost-effective than glucose suspension. According to the FDA, a single dose of Avonex includes 0.5 milliliters or 30 micrograms 1 time per week. However, due to the nature of the drug's adverse effects, one being flu-like symptoms, 7.5 micrograms may be self-administered upon first use and increased in increments of 7.5 micrograms until 30 micrograms are reached to decrease the adverse effect. Let's take a closer look at the structure of interferon beta-1b. Interferon beta-1b has 5 alpha helices located at A1, A2, B, C1, C2, D, and E. It also has 3 alpha loops consisting of AB1, AB2, and AB3. These helices are right-handed, meaning it swirls towards the C terminus. The protein's chemical formula is C908H1408, N246, O243, and S6. It has 166 residues, no carbohydrates, and the 17th cysteine is substituted with serine. The 5 helices are connected by the AB loops mentioned above. So, what's the mechanism of action? Interferon beta-1b binds to receptors IFNAR1 and IFNAR2C, whose subunits are located on the surfaces of cells. Both receptors are agonists, transmembrane proteins, and cytokine receptors. Type 1 receptors activate JAK1 and TEC2, which transphosphorylate. Proceeding to phosphorylate IFNAR1 and IFNAR2C. These receptors bind to STAT1 and STAT2, two transcription factors which are heterodimers that activate antiviral and immunomodulatory proteins with IRF9 by use of ISGF3, which binds to ISREs amongst ISGs. Now, interferon beta uses negative feedback to upregulate gene expression and increase anti-proliferation. IFNAR1 connects to interferon Beta-1b by contact with B, C, and D helices, and IFNAR2 connects to interferon Beta-1b by contact with A and E helices, the AB loop, and IFNAR2's D1 subdomain. IFNAR1 connects to the IFN ligand in subdomains 2 and 3, topped by SD1, which is peculiar. As with other cytokine receptor interactions, ligands would interact with loops of the receptor. IFNAR2's loop in the subdomain D1 is between the 13th and 14th strands, and it is also peculiar, as it does not bind to the loop between D1 and D2 subdomains, but is instead parallel to D1's beta strands. Interferons typically have micromolar affinity for IFNAR1 and nanomolar affinity for IFNAR2. The difference in affinities between receptors is often found in cytokine receptors, though the beta class of interferons have the smallest difference in binding affinity for the two receptors, binding to IFNAR1 at about 100 nanometers and IFNAR2 at 0.1 nanometers. The difference in rates of binding to IFNAR1 and IFNAR2 is observed because of dissociation constants. Now let's circle back to how this has anything to do with my cousin Alicia. Now we know how interferons use STAT1 and STAT2 heterodimers to initiate activity in immunomodulatory proteins through IRF9 and use ISGF3, which connects to ISREs amongst ISGs. We can agree that interferon beta-1b, which comprises Avalox, is an immunomodulatory therapy, and that's what an MS patient needs. Something to stop degradation of the myelin sheath so the CNS can function properly. So why should my cousin take immunomodulatory therapy weekly? Interferon beta-1b therapies can decrease the rate of disability connected to MS, may lead to about 30% less relapses, and prevent lesions from occurring in a patient's brain. And you don't need this every day. This is a long-term therapy or a disease-modifying drug. My cousin can stay active without experiencing extreme bouts of pain, and that's great. Say bye now. It was great talking to you about MS today. Be well.